Hey everyone, and welcome to this explainer. If you are a nursing educator, a simulation lab coordinator, or an administrator, you are in exactly the right place. Today, we're talking about how to completely transform your Sim2Grow system into a really versatile, everyday classroom asset. We're going to explore how to finally get this incredible tech out of the lab, where, let's be honest, it's hopefully not just sitting around acting as a very expensive coat rack, and directly into the hands of your students, literally every single day. Okay, so here's a quick look at our curriculum tour for today. We'll be hitting the ROI and NGN challenge, looking at a truly portable solution, and exploring pharmacology and nursing fundamentals. Then, we'll dive into med-surg and leadership scenarios, how to use this in any course on any day. And finally, we'll wrap up with ROI and your next steps. All right, let's just dive right in. Section 1, the ROI and NGN challenge. We're kicking off our tour by tackling the absolute biggest hurdle educators are facing right now. So, why is justifying simulation ROI so incredibly challenging? Well, we all know the pain points here, right? You buy this expensive simulation equipment, and then it just kind of gathers dust because of limited functionality and the total logistical nightmare of moving it out of the lab. It becomes this massive, heavy investment that students maybe get to touch a few times a semester. And naturally, that makes it super difficult to prove its real value to your program directors. And it's not just about the physical equipment anymore. The stakes are so much higher now with the next generation NCLEX. But here's the cool part. Sim2Grow validates its academic rigor by supporting all 6 steps of Layer 3 in the clinical judgment measurement model. It literally forces students to actively recognize and analyze cues, prioritize their hypotheses, generate solutions, take actions, and evaluate outcomes. Plus, using features like Reveal Later brings these unfolding cases to life, which tests true on-the-fly clinical judgment. Moving right along to Section 2, a truly portable solution. Let's see how a physical solution can actually overcome those really frustrating logistical barriers we just talked about. The biggest game changer here, this isn't some heavy, stationary fixture bolted to the floor. It's a fully mobile dispensing cart, equipped with locking wheels for totally effortless classroom transport. The main takeaway is that this equipment is absolutely not tethered to a lab. It is specifically designed to roll right into your daily lecture, turning literally any standard classroom into an active, buzzing learning environment in seconds. And you don't have to worry about students crowding around a tiny little screen either. Proving its portability is as easy as connecting an iPad via an HDMI adapter. You just plug it right into your classroom's AV system, and boom, suddenly the EMR and the entire Sim2Grow interface are projected up on the big screen. So now a lecture hall of 50 students can engage and participate in the simulation all at the exact same time. It's fantastic. Section 3, Pharmacology and Nursing Fundamentals. Continuing on our curriculum tour, let's look at how this anchors right into foundational nursing courses, where those crucial safety habits are first formed. Now, pharmacology is usually where students start to panic, right? But we can really bring it to life across 5 distinct use cases. You can run scenarios that focus purely on dosage math, then shift gears into weight-based precision. You can dynamically discuss mechanisms of action, have the students spot red flags for contraindications, and practice the absolute vital skill of medication reconciliation. It takes pharmacology entirely off the textbook page, pulls it out of that realm of math anxiety, and drops it right into a practical, simulated reality. And when it comes to fundamentals, contrasting theory with practice is huge. It allows you to augment didactic instruction with actual live demos that emphasize the rights of medication administration and the 3 checks. I mean, you can talk about the theory all day long, but when you physically demonstrate a med pass in front of them, or, hey, even better, purposefully act out a terrible med pass with glaring errors for the class to catch, you solidify those safety fundamentals in a way a standard lecture just simply cannot do. Section 4, Med-Surg and Leadership Scenarios. As we transition from foundational stuff to advanced practice, the situations we simulate get delightfully complex. First up, let's talk about communication. Students use the Sim2Grow EMR to identify discrepancies, sure, but it absolutely doesn't stop there. They then have to role-play actually reporting those issues to a provider using the structured SBAR format. That's situation, background, assessment, recommendation, and readback. Because, it's one thing to spot a medication error on a screen. It's a completely different beast to confidently report it out loud to a physician. This builds that exact necessary muscle. Next, we bring in those notoriously tricky points of care. Students are actively challenged to compare a patient's home medication list with the current EMR orders during high-risk transitions. We're talking admission, transfer, and discharge. This is active learning at its absolute best, perfectly mirroring those exact chaotic moments where real-world medication errors most frequently slip right through the cracks. This also sets up the perfect stage for leadership courses. You can actually simulate chaotic medication disruptions to test whether students can manage competing demands while staying hyper-focused on safety. Imagine running a complex medpass and then throwing in multiple phone rings, random questions, and interruptions. You get to see if they actually catch a near miss and then have them formally document it with an incident report. Let me tell you, the debrief conversation after an exercise like that is just incredibly powerful. Section 5. Any course, any day. Okay, let's dive into how easily this whole system integrates into your daily classroom routines, no matter what specific course you happen to be teaching. So this breakdown shows a true day-in-the-life application. You can seamlessly transition from a morning preclinical warm-up, where they diagnose an EMR, right into an afternoon collaborative group work session where they're hunting for chart errors. The key outcomes here are huge. You are constantly sharpening their critical thinking, building up collaborative problem-solving skills, and enhancing those assessment-based decisions using vital signs as real decision points. And of course, its utility back in the dedicated SimLab space is totally unmatched. You can run distraction drills with purposeful interruptions to really test their focus, or set up self-paced remediation stations to reinforce learning. It is honestly the perfect tool to run quick, high-energy preclinical warm-ups. It gives your students that much-needed confidence boost right before they step onto the actual hospital floor. Section 6, ROI and next steps. All right, let's move to our final destination on the tour and see how all of this builds into a very tangible return on investment. So what does this all mean? The ultimate takeaway here is that maximizing the minutes your students spend practicing translates directly into student success. It really comes down to 3 pillars: better mastery through repeated, consistent exposure, improved NCLEX scores because you're actively training their clinical judgment, and incredibly happy clinical site partners because your students are showing up professional, competent, and safe from day one. That's a huge win. To actually get started, just follow these 3 concrete steps. First off, assign a dedicated Sim2Grow champion, someone to lead the charge. Second, get a super user training session on the calendar to refresh your faculty on the basics, like order entry and printing wristbands. And finally, commit to action. Pilot just 3 new classroom activities in the first 30 days of your next semester. That's it. We've covered exactly how to get this dynamic tool out of the lab and straight into the center of your curriculum. So I'll leave you with this provocative thought to consider as you evaluate your nursing program moving forward. Are your students truly ready for the chaotic realities of clinical practice? By integrating these structured simulation techniques every single day, you can ensure that the answer to that question is a resounding, confident yes. Thanks for tuning into this explainer.